All right, happy Tuesday. We are live. Fantastic. So we've got a couple questions this week. Let me take a gander here. I hope everyone's having a good week and everything's off to a good start today. Tuesday, everyone's favorite day. I used to make fun of all those internet memes that said like, "Hello Tuesday, you can do this Tuesday," and then I subsequently realized that Tuesdays really are the worst day of the week. And all those memes that I used to make fun of 100% apply to me. And just trying to get through another Tuesday. Anyway, so a couple questions. We're just going to kind of go in chronological order from when I received them. At the top of the list, we've got a question about doing surgery in-house, meaning in my office versus at a surgery center. At my current facility, I mostly do minor procedures in minor areas, cosmetic things related to like an upper blepharoplasty, maybe a small brow lift, small areas of liposuction. Mostly things that I do under local anesthesia. Anything that requires general anesthesia or definitely an overnight stay, I take to a surgery center. For a couple of different reasons. One is patient safety is always at the top of the list, so that's number one. Number two is also comfort level. This is an example, so liposuction is a good example of that. The honest truth is, you can just do a better job when you, the patient, are comfortable. You can only get so dense of an anesthesia using just local anesthesia. And so you can just be more aggressive and have a better operation if you are comfortable during it. And so having somebody under general anesthesia frees up that ability to really be as aggressive as you need to be for liposuction and get a better result. So that's the other reason. I will be, so I guess this is hot off the press because I literally just signed the initial paperwork on Sunday, but happy to announce we're going to be moving. Won't happen for a couple years. We're looking at like probably 2 years approximately, but it's a new building, brand new building going to go up. It's going to be absolutely fantastic, good location. I will have a full functioning operating room there. So I will start doing more general anesthesia operations there, breast augmentations, liposuction, a lot of things I've been taking to surgery centers will be able to do in the office. But that's kind of in the pipeline. For now, I basically go wherever the operation demands, and so commonly it will be a surgery center. So we'll circle back to that because I think there are some, as I said last time, the rabbit holes always go deeper. I could talk about any one of these questions for a really long time. So in the spirit of trying to cover as much material, we'll leave it there for now. And if we've got some time at the end, I'll circle back. We'll talk about what is a surgery center, what makes it safe, what does it mean to be accredited, what does it mean to be JCO certified, Quad ASF certified. Is it safe to do surgery in someone's office? Whose office? What makes them safe? There's a lot we could talk about in there that's not that exciting, but is extremely important because we're talking about your safety. But for now, I'll just stick to answering the most concrete portion of the question. Next in line, we've got the vaccine. Somebody had asked, should I get the COVID vaccine before surgery or after surgery? It's really going to be case by case. The short answer is I tell anybody, if you can get the vaccine, get it. Get back to normal life. Get this virus off the table. Just be done with it and move on. So I say get the vaccine as soon as you possibly can. If you happen to have surgery scheduled for Monday and as soon as you can get the vaccine is Friday, maybe wait till after or maybe bump surgery back a week if it's possible. You just don't want to be sick or under the weather going into surgery. Most patients do fine with the vaccine, have a little bit of a sore arm, and that's the end of it. Some patients get flu-like symptoms. It can be pretty significant. Muscle aches, soreness, joint pain, even congestion. I've had people tell me they've gotten fevers or chills, so you can definitely get significant symptoms from it. So it's more about the timing. So most people get that as the first 24 to 72 hours if it's going to happen. And so at the very least, I would say give yourself minimum 3 days, ideally 5 or more between the date of the first vaccine and your actual surgery date. But I wouldn't put it off. I say get it done. This is our exit out of this pandemic and the masks and just quarantine, getting tested every couple days. Oh my God, my kid has a snotty nose. They can't go to school even though they're fine. Anyway, get the vaccine, do it, don't wait. If you got surgery, try to wait a couple of days, and then if need be, get the vaccine afterwards. But it's going to be very case by case. If you're on my schedule coming up and you have the option for the vaccine, just call me directly or email Gabrielle, Gabrielle at twps. Gabrielle at twpstx.com. It's a mouthful. The Woodlands Plastic Surgery, Texas. That's an even bigger mouthful. Gabrielle, twpstx.com. Process for patients inquiring and process for getting consultations scheduled. It has been my task and job to make this process as easy as possible. The fact it's a question makes me very concerned that I'm not doing a good job. Basically, go to the website. There's a consultation inquiry on there. That's probably the most convenient way because it's open 24/7. Fill out the link, put your name, type in your preferred day. That doesn't book the day, but it lets us know when you want to be seen, and then we can either get you booked on that date or we'll call you back and figure out a date that you can come in, depending on the surgery schedule and the clinic schedule. You can contact us through social media. You can direct message us. We have Facebook Messenger. You can direct message us on Instagram. And then also you can go the old-fashioned route. Type into Google, Woodlands Plastic Surgery, click the little phone call button. That'll go straight to us. Call us, leave us a voicemail. We're going to air one of Gabrielle's pet peeves. If you don't leave us a voicemail, we don't know that you called. It's not like a cell phone where you see missed calls and know that, we get so many robocalls and junk mail calls and rep calls and drug device calls and just so much nonsense. We cannot possibly determine who's a patient that we missed and who is more junk mails or robots. So please, if you do call and don't get through to us for whatever reason, please do leave a voicemail so we can call you back. Otherwise, we don't know that you called. Okay, specials this month. Let's see here. Ooh, that's a nice special. So we've got buy at least one syringe of filler and get one area of disc port for free. I don't remember approving that. That's kind of a nice one. So if I were you, I would do that because that's kind of a nice deal. Purchase 3 hydrofacials, get a free revision pigment kit. That's a pretty good deal too. If you've never had a hydrofacial, you should definitely get one. Everyone should get one. It's basically, picture like a facial at a massage meets skincare and rejuvenation. So it's extremely pleasant. It's very relaxing. It's peaceful. It doesn't hurt. It's basically just kind of a deep cleanse. Susie delivers it. She puts music on. We've got lighting. She talks to you. You just lay down. There's a blanket. I kind of feel like one right now at the end of this Tuesday. It's just an extremely pleasant thing. And on top of that, it's excellent for your skin. So buy 3 hydrofacials, buy 10 hydrofacials. You won't be sorry. But the special is 3 hydrofacials, get a free revision pigment kit. And I'm going to add a little Correa special on that. If you don't have pigment issues, but you're still interested in the special, just call. We're pretty flexible with people. So if you don't have a pigment issue and you're interested in some other skincare thing, we should be able to kind of mix and match or do some sort of like for like replacement. Just call it the live Q&A special. Say, hey, I tuned into Dr. Correa's live Q&A. He said I could do this. And Gabrielle loves it when patients tell her, Dr. Correa said I could do this. Those are her favorite words to hear from patients' mouths. Okay, last special, 10% off Neocutis skincare. There you go. All right. Next question. Why would I need a lift? Can't I just do this with an implant? Very difficult question to answer. Very difficult to answer without photographs. At the end of the day, an implant can only do so much. if the, in kind of objective terms, a lift is technically all about nipple position. So if the nipple is in a good position on the breast, then you either don't need a lift, or if it's a little bit droopy, probably an implant would be fine. If you don't like the position of the nipple and areola on the breast, then that means you probably need a formal mastopexy or breast lift. The only true way to lift a nipple and areola and reposition it is to do a formal surgical lift, which is called a mastopexy. What an implant does, is kind of fill out extra skin. So if the nipple's in good position on the breast and it's just kind of dropped a little bit because of kids or aging or babies or breastfeeding, something like that, then an implant often, depending on the size you go, can sometimes just kind of fill out what you have, and then it gives the illusion of a lift. And really what it does is it fills out the under boob. My favorite contemporary terms, under boob, side boob. Fantastic descriptive terms. But what an implant will do is fill out the under boob. And so because the nipple and areola have more breast skin beneath them, the nipple appears higher. But if you actually look at photographs, and compare, you'll actually see the nipple position doesn't actually change. It kind of just moves forward. And then that bottom part of that lower pole of the breast, or the under boob, gets filled out by the implant. The second reason to consider a lift, even if you technically don't need it, is if you like more of that kind of sculpted, augmented appearance to the breast. So if you look at, during my consultations for breast augmentations and breast lifts, I always look at the gallery, always reference the gallery, show you examples. I try to find examples that have similar anatomy to you so we can give you a realistic visual of before and after surgery. But anyway, so if we're looking at the gallery and you're attracted to the results that are more of the augmented appearance, more of a curvaceous or a sculpted appearance to the breast, then often that will tip the scales in favor of doing a lift. So like I said before, if we're doing a augmentation with no lift, it fills out what you have. It doesn't actually lift things up. It just kind of fills out that under boob, gives the illusion of the nipple being higher up, but it doesn't actually lift it up. And that upper part of the breast that really gives that fullness that a lot of people are attracted to, that won't happen unless you do the lift. Depending on your tissue, you still may or may not be able to get that, but that's another reason why we might consider doing a lift. And then last thing, I just random off the top of my head, common misconception out there, people think that the implants support the breast, and so you want like a nice, strong, good implant to lift the breast up. Other way around. It's actually the breast that supports the implant. So if you don't have good tissue quality, don't have good elasticity, you put a gigantic implant in there, it just drops. It's actually counterproductive. Anyway, just wanted to kind of throw that out there as one little added piece of info. So bear with me while I do some scrolling. Let me see if there's been any questions actually joined, or any live questions fresh from the stream here. Someone's here, that's so sweet. Hi, Haley. All right, let me take a look here. Okay, I'm not seeing any live questions on here, which is fine, which means, thanks, Susie. She said my skin looks amazing. I did a VIPO Precision Plus Thursday last week, so I'm now on day 6. Tomorrow's day 7, so I'm kind of flaking a little bit right here. But went great. I took a picture every day like I was instructed to do. But yeah, really made a difference, I think. So it'll be fun to look at those before and afters. I'm sure we'll post them on social at some point. But it's a nice skin resurfacing treatment. So thank you, Susie. Well, we're up at 5:47. So like I said, the goal is to kind of keep things brief and concise and nice and tight. So if you guys think of anything else, like I said, we're going to be doing this every week. So like I said, send in all your questions. Nothing is really off limits. If you want to throw some curveballs or throw some fun things my way, if you want to talk about the latest celebrity disaster, or send in internet pictures like what the heck happened to this person, you know, the whole point of this is to be fun, be informative, and just kind of get your little 15 minutes of plastic surgery for the week. So hope you guys are having an awesome week. Hang in there. Tuesday, almost done. All right. Have a good one. I'm out.